My name is Kathy. I am married. I have not had any children. Thank goodness. I work upstairs with Dr. Dickerson. I've been with him for 13 years. So I love my doctors.
Okay, and you two are with a woman's place?
We are with a woman's place.
And a little bit about you?
I love working with Claire.
My name is Claire. Been married for 20 years this July. I have 2 children, which I delivered vaginally, each one. I am a registered nurse, been a registered nurse since 2005. Worked in labor and delivery with the providers upstairs, Dr. Andrea Dickerson and Dr. Gordon. I like to help others, love to decorate, love to bake, love to cook, and work with the youth at our church.
So what was your first impression when you heard about ThermiVa?
I was very interested in it, particularly for the vaginal dryness. I have a really bad problem with that.
Okay.
I was thinking at first, hey, this is pretty good for a lot of women, hence working in labor and delivery. You could see a lot of gynecological problems that women have, and thought this would be probably pretty good for a lot of women. At first was not interested in it in myself until I spoke with Dr. Edward Dickerson in detail about it.
Okay, and so he helped you decide
Yes.
that it might be right?
Yes.
So, if you don't mind, what issue was your primary concern?
Perspiration was one. And then just some simple different things that kind of led, hey, maybe I could get a little bit better with elasticity and sensation. And he discussed, hey, let's give it a try if you don't mind. And so I did it
You noticed results how soon, would you say?
right away.
Right away.
Right away. The first probably 3-4 days after, I think probably maybe 4 days at least, definitely seemed to be, the perspiration was not there. Since that time, a little, but nothing like it was. And then of course there was a huge difference with sensation and laxicity. My husband could tell a difference, so things were definitely different,
So,
for the better.
okay, and was that something that you discussed with him ahead of time, or was it
Yes.
kind of a surprise?
He knew.
Oh.
He knew.
Always discuss it with the husband first. Oh yeah.
He knew. So he was just like, yeah, okay, whatever, And then afterwards he was like, oh, okay.
Oh.
Definite tightness. The sensation was there. Definitely helped with the desire. Helped with several things.
Mine was a lot of dryness. Intercourse was very painful. Very
Okay.
painful. It helped quite a bit. Just big difference.
Okay.
Big difference.
Okay.
Helped quite a bit.
And was that something that you discussed with your husband as well, or?
Yes, I did. I talked to him about it.
And how did he feel? What was his reaction at first?
He was like, well, if you think it'll help, and you want to try it. So I did. And he's glad I did.
Yeah.
He's like, well, it's worth a try. I'm willing to try it. So he said, okay, if that's something you want to do, do it. And he's extremely glad I did do it.
Everything seems to be better.
The skin is different,
Overall,
definitely.
yes.
Yes, definitely different.
Okay. What was the actual treatment like?
Staff was pleasant, doctors were awesome. I mean, it was great. Experience was great.
Okay, good.
I can't wait for the next treatment. I'm ready.
There's definitely been such a huge transformation already. It's hard to imagine what it would be
What's
like
gonna be
after
next,
3.
yeah.
I think the one area that may help a little bit more with another treatment or 2 would be, there is an occasional dryness that I've had a problem with, but it's not my biggest concern. So I'm thinking, would that get even better with the more treatments?
Okay, and I guess we'll find out.
Yeah, we'll find out. There's definitely have been some concerns that patients have talked to me, and I was able to bring up ThermiVa for them. So I've definitely seen it, and have heard patients come in and you know, with questions that definitely this could help them with their problems.
Yeah, I've already had a patient talk about vaginal dryness, and I actually talked to her about the ThermiVa.
Definitely with the changes after a vaginal delivery that I can speak of after the 2 deliveries and stuff, and have seen just the differences in myself and patients who complain about different problems after vaginal delivery and how this could really benefit them.
That are hitting the menopausal stage, and believe it or not, they're still wanting to be sexually active, and they can't because of the vaginal dryness. You know.
And things I've found out with the younger population is coming in with, and they're pregnant with their first child and want an elective C-section, and I'm like, that's a major surgery. You don't want to do that. She said, well, I don't want my vagina messed up. So I'm like, well, we have a fix for that. Deliver vaginally, much better recovery, better for both you and baby, and then husband can pay for your vagina to be fixed with ThermiVa.
Beautiful. Would you recommend this?
I would. I already have.
Definitely. Mm-hmm.
So you've recommended to patients or who?
Recommended to patients.
Patients. Mm-hmm. And close friends.
Yeah, and my stepdaughter's friend, actually.
Who wants to go in there and cut
Right.
when you don't need to cut,
Mhm.
right?
Right, exactly.
We don't need to cut,
That's right.
so